Hi, I'm Sharon Arndt, and throughout the COVID-19 response in Fairfax County, I was Assistant Liaison Officer for community and nonprofit organizations. My task today is to highlight a nonprofit organization, but I find that I am challenged by that as it was truly remarkable the hundreds of nonprofit organizations and community-based organization partners who gathered together weekly beginning in March of 2020 to carry forward public health guidance for containment and mitigation. I could not have accomplished my role without the partnership of our nonprofits, our community-based organizations, the faith-based organizations, and my human service system colleagues who supported public health throughout the pandemic. Early days of the pandemic, some of our nonprofit partners donated critical personal protective equipment supplies to county response. Our nonprofit partners and community-based organizations distributed over 80,000 face covers to residents, many made by countless volunteers throughout the community. Our nonprofits and community-based organizations stood up systems to support basic needs for residents needing additional resources in order to sustain their households. And many of our organizations help to connect residents to testing and vaccination throughout the pandemic. So for all of our nonprofit organizations and community-based organizations and everyone who joined us weekly on the Community Provider Coordination Team calls, thank you for helping to create the conditions in Fairfax County in which our community could be healthy. You are an asset to the public health system, and we sincerely appreciate you. Thank you.
Hi, my name is Jess Werder, and I'm the Deputy Director of Public Health Operations for the Fairfax County Health Department. I am so happy for this opportunity, and I want to direct my thank yous to the partners who worked behind the scenes across county government and contributed to an historic public health response in our community. When we reflect on what we achieved together in the face of COVID-19, it's natural to talk about our community's COVID case counts, about testing availability, contact tracing successes, and vaccination numbers. But what we rarely have the opportunity to acknowledge is that behind all of those numbers, there are hundreds and hundreds of people who made those things possible. But they did so in often hidden or obscured ways because they were not on the front lines. I want to say thank you to all of our county partners who played a role in helping us to execute contracts, approve budgets, establish positions, and hire people under enormous pressure and unprecedented deadlines. Thanks to our technical teams, our facility staff, our legal experts, county communicators, administrative support professionals, and so many others. The mundane administrative work of our government can be easy to take for granted, but those are the things that make things work in local government. Thanks to all who kept the wheels turning in support of public health systems during our pandemic response. You're much appreciated.
Hello, my name is Bingbing Yang, a community health specialist with the Fairfax County Health Department Outreach and Engagement Team, dedicated to the Asian and the Pacific Islander community.
Hello, my name is Carla Paredes Gomez, Community Health Specialist of the Fairfax County Health Department, dedicated to conduct public health outreach with the Hispanic community.
Community champions, you're the everyday people who became our heroes. You're the real people of public health who advocated for the community needs and supported our neighbors.
We appreciate your efforts working with us side by side, conducting boots on the ground and door-to-door campaigns.
Thank you to every community champion who helped create the condition in which the Fairfax community could be informed.
You are an asset to the public health system, and we appreciate you.
Thank you.
Hello, I'm Ben Schwartz, and I was the Deputy Incident Commander for the pandemic response. I'd like to recognize the many important contributions of George Mason University to our pandemic response. Their first priority, of course, was to protect their students and staff, and they really did an excellent job at this. Testing was widely available, both for those who were ill and for surveillance. They developed and implemented a COVID health check reporting tool. Student health and other medical staff did a great job detecting and quickly responding to outbreaks. And vaccination, once available, was provided to virtually all students and staff. The result of all this work was to very successfully minimize disease in the GMU community and reduce disruption to classes and other collegiate activities. But GMU's contribution went far beyond this, as they also looked outward into the community. They were one of the health department's largest partners, vaccinating thousands of community members at Eagle Bank Arena. In addition, GMU's MAP Clinic was one of our key vaccine equity partners, establishing mobile clinics in many disadvantaged areas of the county and vaccinating those who otherwise would have had less access to these life-saving interventions. So I want to give a shout out to our GMU partners throughout the pandemic and to share how much we appreciate and value your contribution and how much we look forward to continuing this close relationship with you. Thank you.
Hello, my name is Carla Paredes Gomez, Community Health Specialist with the Health Department, dedicated to conduct public health outreach with the Hispanic community.
Hi, my name is Jennifer June. I'm a community health specialist and I'm dedicated to doing outreach to the Asian Pacific Islander community. Wanted to thank all of our partners who collaborated with us to ensure that messages were conveyed through multicultural media. Couldn't have done it without you. You're a crucial part of our team.
You helped our multilingual community receive accurate information in a timely manner. Thank you to every partner who helped create the conditions in which our Fairfax community could be informed. You are an asset to the public health system and we appreciate you.
Xin cảm ơn các cô chú và anh chị em đã giúp chúng tôi trong đại dịch.
Muchísimas gracias. Sin ustedes no lo hubiésemos logrado.
Hello, my name is Anthony J. Mingo Sr. I have the privilege to serve here at the Fairfax County Health Department as Division Director for Community Health Development, as well as the Project Director for the Stronger Squared Health Literacy COVID-19 Grant Project. First, I'd like to sincerely thank our numerous faith-based and houses of worship partners who selflessly and sacrificially served and supported our communities during the pandemic. We thank you. In addition, Pastor Robert Kennedy of Emmanuel Worship Center and Pastor Francis Jima of Church of the Living God, we sincerely thank you and your lay leaders for your heartfelt dedication to the Stronger Squared Project. We thank you for helping us ensure and build trust in our communities. Thank you for helping us build resiliency. Thank you for helping us build capacity and empower our communities of color. Yes, the pandemic has brought much pain and we've had to sacrifice. We had to endure, but we thank you and honor you, and we are assured under the one who has called you to your place of leadership that a great promise that there will indeed be a great return and all things be made new. We thank you for trusting in us here at the Health Department. We thank you for working alongside us here at the Health Department. Thank you for standing firm and letting nothing move you, always giving yourselves fully to the work. Be assured that it is now proven that your labor was not in vain. We thank you.
Assalamu alaikum. My name is Shafiq Qureshi. I'm a community health specialist working at the Fairfax County Health Department. I am dedicated to conduct public health outreach in the Muslim and Indian communities. Community leaders and supporters, you are the everyday people who became our heroes. You are the real people of public health who advocated for the needs of our communities and supported our most vulnerable neighbors. Thank you to every community leader who helped create the conditions in which the Fairfax community could be informed. We appreciate you as an asset to the public health system. I thank Imam Naeem Beg, Stacy Picard, and attorney Faziaddin from Darul Hijra Islamic Center, Brother Jamal Kakar at Medina Islamic Center, Brother Fazal Wahab Mumtaz from ICNA Relief, Dr. Alawi from Adams Center, Brother Shahriyar Ahmad from Masjid-e-Noor, Mr. and Mr. Chopra at Rajdhani Mandir, Sapna Rohati and Raj Kapoor from Durga Temple. Thank you for your support and collaboration with the Fairfax County Health Department.
I'm Chris Revere, the Deputy Director for Innovation and Planning at the Fairfax County Health Department. During the COVID-19 pandemic, I served as the Assistant Liaison Officer to the private sector. Peter Drucker, who's recognized as the father of modern management theory, said that a healthy business cannot exist within a sick society. And we learned that painful lesson all too well during the pandemic. But it was through the collaboration and perseverance of our private sector partners, our many chambers of commerce, and thousands of businesses across Fairfax County that we were able to save countless lives from sickness and death. I can recall many examples of businesses supporting their customers and their employees by creating a healthy workspace and by providing support through our vaccination clinics and our testing facilities, and in some cases even driving their employees to be able to get those services from their local health department. So I salute you for stepping up. I salute you for your determination, and we will always appreciate the support that we received from the private sector during this important moment in our history. Thank you.
Hello, my name is Bingbing Yang, a community health specialist with the Fairfax County Health Department Outreach and Engagement Team. I dedicated to conduct my outreach to the Asian and the Pacific Islander community. I recall when COVID-19 started in China, there were tremendous concerns in the API community. So Dr. Gloria, the Health Department Director, and Sharon, the Community Health Development Division Director, organized a meeting immediately with our partners. They listened to the community concerns and evaluate the community risk of COVID-19 and what we could do in the future to prevent the spread of COVID-19. Since then, more and more partners and champions have joined the pandemic response team. I'm so proud of the first COVID-19 response of the health department. And to all our partners and champions, what you have done demonstrates precisely the meaning of public health. Thank you to every partner and champion who helped create the condition in which our Fairfax community could be informed. You are an asset to the public health system, and we appreciate you. Thank you.
Hello, my name is Mariama Kaloko, Community Health Specialist with the Fairfax County Health Department's Community Health Division. I conduct most of my outreach to the African and Muslim communities. To the community leaders, partners, supporters, we appreciate your efforts working with us side by side, conducting messaging campaigns, testing sites, equity clinics, providing resources to people in quarantine and isolation, and so much more. We thank you and we truly appreciate all your efforts in supporting the health department during the COVID-19 pandemic. Elizabeth Rainey at Joyful Hands, Dr. Mary J. Samba at Loving Hands Touch, Pastor Kennedy at Emmanuel Worship Center, Father Isaac Tedla at Kiddush Selassie Ethiopian Orthodox Church, and so many more. We thank you.
Hello, my name is Shauna Severo, and I'm the Director of the School Health Division within the Fairfax County Health Department. And it is with great pleasure that I get to recognize all the amazing work that our public and private school partners did, as we had to rely heavily upon you when we responded to the COVID-19 pandemic. The Health Department has recognized over the years that we must rely on our community partners if we're to successfully address population health issues. And this was never more true than over the last several years, as we've all been challenged by the COVID-19 pandemic. The school systems were required to implement new policies, identify and report cases, develop whole new lines of communication, and to work side by side with the health department to help reduce the spread of COVID-19 in our schools and ultimately in our communities. This was a Herculean task, one that required synergy between all of our public health partners. The fact that the pandemic guidance for managing COVID-19 disease was changing by the day and, quite frankly, sometimes by the hour, made this even more daunting. So in closing, I know I speak for our agency leadership when I say we will forever be grateful for all of the public and private school support and your many contributions to our emergency response. Thank you so much.